to the Pickens County Board of County Commissioners work session on Tuesday, January 19th. I'm your new chair, Kelly McNicholas Curry. Also in the room with me is Terry Anderson, and everyone else is joining us from home, including our new vice chair, Patty Clappers in a different part of the building. Joining us from upstairs, we have our new commissioner, Francie Jacober, and our old hats, Greg Poshman and Steve Childs, with us. And we'll turn it over to our county manager, John Peacock, to kick us off on our first item, which is a COVID-19 update.
Thanks, Kelly. I'm going to share my screen here. Give me just a second. All right. Hopefully you're all able to see that. So lots to talk about today in our update. We're going to talk a little bit about where the data is, where we're at with our red level restrictions and 5-star program. Talk a little bit, another update on financial resources for individuals and businesses and how we're moving forward on those, as well as an update on vaccinations, and then questions and direction from the board. So this was actually as of yesterday. Our incidence rate was at 2,753 per 100,000. That's our 2-week average. Per the Board of Health's direction, we're tracking both 7-day and 14-day averages. So your 7-day incidence rate is the blue line, and 14-day is the green line. The blue line is going to be a little bit more elastic. It's going to respond more quickly up and down to changes in our incidence rate. But the reason that the Board of Health wanted to track it was as a leading indicator of where our 14-day incidence rate, which is what the state is tracking, how that would trend. And we are seeing downward trends. I will caution that oftentimes test data will have a lag time and get included in these trends later. And so we can see from day to day that sometimes these downward trends do level out or go up. But overall, this is a positive start for us in looking at our 5-star program. Our incidence rate, as you can see, up until recently had been over 3,000. At 2,753, we are still the highest incidence rate in the state, but our goal is to get that down. Similarly, our positivity rate has been also leveling off with a slight downward trend for all tests and a fairly significant downward trend for children. And so we're currently sitting at 12% positivity and 9.2 over the last 14 days for children. The Board of Health and the organization did move to red level restrictions at 12:01 a.m. on Sunday. There's a list of the red level restrictions across all sectors. As I think everyone is well aware at this point, indoor dining at restaurants is prohibited. However, takeout, curbside, or delivery options are still available, as is outdoor dining, where a restaurant is set up to do that. Obviously, that's challenging this time of year. really want to encourage the community to support our restaurants, to take advantage of takeout, curbside, or delivery options, because this is a really difficult time for those folks. Additionally, any on-premise alcohol, and this would be for outdoor dining, is to cease at 8 p.m. To-go orders for alcohol may continue till 10, and then outdoor dining has to end by 10 p.m. Ski area is pretty much the same. We're looking for improved mask and distancing enforcement and lines. Indoor dining has also been eliminated on all the ski hills. We're continuing to monitor capacity. Lodging, looking for increased enforcement of one household per unit, regardless of when the reservation was made. Was a clarification as staff went back to really look at the motion that was made by the Board of Health. It was to go to the red level restrictions and to continue to monitor lodging capacity, and so we did make that correction. The state has a report card that tracks the county's eligibility for the 5-star program. And just like our local data is tracking, the state data is tracking positively for us getting qualified for that program. 3 out of the last 14 days are in a sustained decline. So if we continue that trend, and that's based on a 3-day rolling average, the incidence rate will qualify for the 5-star certification in 11 more days. Percent positivity, we are just now starting to dip below that 10% line. We need to hold that for 7 days in order to qualify for the 5-star program. So we'll be watching that. And hospitalizations continue to be pretty stable in terms of ICU beds in use, as well as our local hospitals data that remains in a pass status. So we are hoping with the tightening of the public health orders, married to just a natural decline this time of year in activity in our resort economy, that we'll be able to continue these trends and get qualified for the 5-star program. We do have a application prepared that we are planning to submit this week. It does require a letter of support for the 5-star program once we are eligible according to the metrics, be submitted from the hospital, municipalities, local law enforcement, the Board of Health, as well as the Board of Commissioners. I would like to get direction from the board today to prepare a letter for the chair's signature in support of an application for the 5-star program. Just real briefly, a reminder that counties in red level restrictions have to meet the following criteria: 2-week sustained decline, percent positivity under 10%, or 10-day cumulative decline, and under 90% of ICU beds in use. Businesses that qualify to be certified once the county qualifies for the variance for the 5-star program would be able to operate at orange level capacities. I'm going to stop there and take a breath and just see if there are any questions, and if we can have a conversation about the board supporting an application.
Thanks,
the
John.
Board of Health application.
Patty, go ahead.
Yeah, I have a question. John, since we technically volunteered to go into red level because we didn't meet 2 of the matrix qualifications, does that give us any more flexibility? I mean, has any other county volunteered to go red and then had to follow the red, you know, requirements to get out of red, since we really didn't need to be in red?
Yeah, Patty, so we did confirm with CDPHE that because of the governor's order and the fact that we voluntarily went into red, that it would be a local decision to come out of it.
Okay, the other question I have is, the other counties that were red, that the governor just, a week or so ago, took them out of red to orange, did they all qualify, or have any of them applied for the 5-star program that we know of? And which counties might those be?
These statistics may not be totally correct because they're off the top of my head and I don't have them in front of me, but I believe there have been around 10 applications for 5-star, 8 of which have been approved. Yes, some of the counties, for example, Summit County is a close to home example of a county that was in the red, qualified for the 5-star program because of having the decline in incidence rates and such, but is operating at almost Orange Plus now, very similar to what our Orange Plus requirements were.
Because I think getting a letter, of course, having a letter drafted, ready to go is important. Not knowing the time frame for actually getting approval to do 5-star, and the fact that we volunteered to go into into the red level red. I'd like to see us maybe see if we can't get the ball rolling sooner than later, so that when we meet any of the criteria for 5-star, we're ready to go. We're not just then applying, then having to wait another week, 2 weeks for the state to give us approval. So we're kind of ahead of the game, since we are kind of ahead of the game now. So I'd like to see us maybe look into doing that, so we can get people back on board.
Thanks, Patty. Other questions?
Thank you.
Steve? We see you trying to unmute.
I would agree with Patty to send the letter in now, to have the application already submitted and be ready to roll with it when we qualify for it. We don't want to be applying, wait until we qualify and then apply, and then have a delay in the processing of it or whatever. I think we owe it to our businesses, who have, many of which were really complying with everything we asked them to do, and we want to get them all back up and running as best they can, as soon as possible.
Yes, Francie. You're muted.
John, when you said it'll be a local decision, are you talking about coming out of red being a local decision?
That's correct, Francie.
So if we're not in red and we decide to come out of red, why do we need 5-star certification?
So one, we're using that as a framework that's been shown to work to bring down the incidence rate. Our goal is not really related to where we are on the dial so much as getting our incidence rates down at this point. And so the red level restrictions in other counties that had high incidence rates were shown to bring incidence rates down. And then the 5-star program is a way to put extra protective measures into place. And it does 2 things for us. One, it gives us a better enforcement, a quicker enforcement mechanism, so that individual businesses who choose to violate the public health order can have those capacity limits withdrawn, and we can hopefully deal with violations or risk on a more individual basis, right now the court process that we have to go through is frankly, it responds too slowly to those violations. So we see an advantage on the enforcement side. And then two, by following the state structure, even though indications right now are that the state is going to continue to loosen up, in the event that, you know, a surge either in hospitalizations or incidence rate across the state, if the state starts to put counties back into higher levels on the dial, we'll have our variants already in place and accepted by the state. So those were the reasons we were looking at.
All right, thanks. And I have one kind of random question. Our incident rate that we report within the county is way off of what the New York Times reports every day. And I'm just wondering, where does that info at the New York Times come from, and why is there such a huge disparity? Do you know?
Greg seems to have a hand up. I think they're using the Johns Hopkins website. Is that right, for the New York Times? They may also be using a 7-day rolling average, which is what a lot of folks are using versus 14. Sorry, Greg, go ahead.
Yeah, sorry, I didn't mean to butt in. Only that the charts that they put out, CNN and the New York Times also, they put out a chart which honestly is misleading at first glance, because they say we have 22.5 deaths. And what they really mean to say is we have 22.5 deaths per 100,000. And if you divide it by 17,778, you get 4, which is what we've had. We've had 4 deaths. But when you first look at that chart, it says Pitkin County has 22.5 deaths. So anybody local who's been paying attention looks at that, and it causes panic. You know, and so I think it was really a misleading chart done with the expediency, and they didn't put per 100,000 where they should have. And if you read it further, you find that, but if you don't, it causes panic. And I saw that happening over the last few days, where people were seeing that and thinking, oh my God, we've been misled. You know, who's dead, who died? You know. So it's unfortunate, but if we read into it, you see that it's actually charting what information we have from the state and locally. So I think that if that answers your question, that was the incendiary thing that happened over the weekend with those charts.
Well, actually, I was thinking about the incident rate, because it shows like, I don't know, 248 or something like that per 100,000 for Pitkin County.
So Francie, I am going to confess I haven't looked at the New York Times data, but I'd be happy to take a look at it. My guess is that they're using either 3, 5, or 7-day number instead of a 14-day, which is what we've been using, and that may explain the discrepancy there.
John, I have a few questions. So, and I'm sorry if I missed this, but if we voluntarily move back into the orange, does our 5-star qualification grant us yellow level operations?
Only if we're meeting the metrics for the state's orange level. So if we move into orange, let's say our incidence rate is still in the red or any of the other 2 metrics, then we wouldn't qualify for that variance. You have all the metrics have to qualify for the level that you're seeking additional relief from or variance from.
So then is that report card that you showed us specific to being in the red? Like, would that change?
Right now,
would that report card look different?
Correct.
Okay.
That's correct. So the report card, so the percent positivity would change, the incidence rate would change, hospitalization stays the same.
Okay. All right. Maybe in a next, you know, if we start to see more, if our positive trends continue positive, maybe what the orange report card would look like would be helpful in a future update, so we can know what we're gunning for.
That's easy to do.
Okay, cool. And then is the BOCC the last letter on the table? Have we shored up the other letters of support?
My understanding is that, yes, on the hospital, I think the municipalities and county are making their decisions over today and tomorrow.
Okay. And then regarding moving into the 5-star, how is our consumer protection team and law enforcement going to identify which, restaurant, or, which businesses have qualified? Because obviously if they're going from place to place and checking these things and the activity levels look different, there needs to be some way to identify who's eligible for those differences.
Yeah, and my understanding, Kelly, and I'll double check this with the consumer protection staff, is that a certificate is issued that's posted in the window in a visible place for 5-star certified businesses.
Okay. Okay, well, thanks. Well, let me just check in with the board. I'm gonna assume support for the 5-star letter. If there's any disagreement with that, raise your hand now, please. Okay. All right, John, thanks. Have staff craft that and we can get that prepared.
All right, I think we are in the process of preparing it for your signature now. So, I showed this slide last time, but just a reminder that we do have financial assistance resources, both for individuals as well as businesses at our covid19.pickingcounty.com website. And encourage folks to go out to those. I'm just going to go over a few things now. We are finalizing, knock on wood today, contract with Aspen Community Foundation for distribution and monitoring of funds for 3 purposes. One is support for nonprofits. The other is a navigation program to help individuals and businesses from Aspen to Parachute navigate to federal, state, and local resources, and then business grant support opportunity. We had initially talked about human services working with the Aspen Community Foundation to identify the distribution of the 400,000. What is being proposed based on where we're seeing direct services to COVID impacted individuals and families being mostly delivered, is looking at 2 tranches of funding going out to nonprofits, one this month, the other next. In March. I forgot February in between there. I'm trying to shorten the year, I guess. So right now, what Human Services has recommended and tentatively approved pending our contract are the following distributions: Aspen Family Connections, Catholic Charities, Family Resource Centers, La Medici, Garfield 16 Family Resource Center, River Center of Newcastle, and Picking County Economic Assistance, which is our internal team. The goal here is to provide support for both our residents, but also our workforce who might live in Eagle and Garfield counties. So this was the determination of where the needs could most readily exist and be met. Additionally, we have $100,000 to really kickstart the Navigator program, with the balance being picked up through private donations for the rest of the year. Any questions on that?
Yes, Francie.
It was actually a leftover question from, before the money discussion. Is it okay if I circle back for a second?
Yes, please.
So I wrote a letter to Jordana, and I copied John Peacock on it about the lodging community not getting the letter that they didn't have to restrict to 50%. And so it's just kind of a general question about communication, and also the fact that, I talked to John Ely yesterday about this, the fact that we didn't know we were being sued until the TRO was declined by the judge, and just wondering about sort of the chain of communication and how we find out about things like the suit and the lodging and all of that stuff that's been going on in response to the Board of Health order.
Yeah, so typically, Francie, that's my responsibility. So, or John Ely's responsibility to be informing the board. Oftentimes, a filing will be picked up by the press before we even see it, unfortunately, on a lawsuit and such. And so there have been times where I've found out, as well as board members have found out, because a reporter's called and said, hey, this has been filed. Do you have any comment on it? But before we even get a notice. And so that's always a challenge. I think that was, we were hearing rumors that there may be something coming, but we did not necessarily know for sure when it was filed, and we know the press was certainly keeping a close eye on that. Similarly, with the decision that emerged with the request for a temporary restraining order, we were actually preparing for what we thought was going to be a hearing. There was a summary judgment there, and we found out about it. I think we informed the board probably within 20 minutes or so of finding out about that decision, but it came to us fairly late. The issue, unfortunately, with the understanding of the lodging, that was frankly a staff error in understanding what the motion was, and it's one we caught late.
You're muted, Francie.
You're muted.
Francie, you're muted.
Hey, Francie.
Yeah, it wasn't so much the misunderstanding of the motion. I get that totally. It was just that the lodging establishments didn't get notice, and neither did we, that it wasn't actually going to go to 50%. And so I read about it, saw it in the paper, and then I saw it. Then I went to the website and saw it there, and the lodging people that I've spoken to didn't have any idea that it had been changed. And so my real question is, as a newcomer, is, and I asked this to John yesterday, it seems like I'm sort of beholden to read the newspaper every day, and but I understand your answer about the lawsuit thing, and like I said, I spoke to John yesterday, but so is that a good idea for me to read the newspaper every day so that I know what's happening with the county? That's basically my question.
No, and I will own not getting that out to you, Francie. My apologies.
You don't need to apologize. You do plenty of work, no worries.
Yes, Greg?
Yeah, thanks, Francie. I do appreciate you bringing that up. Those are the sort of things that, we're constantly working out, and I really do appreciate it. The concern I had, I've got to share, that I'll share, is that while electeds are probably used to being sued, regardless of how we find out about it, I was just concerned about the Board of Health, the volunteer members in the Board of Health who probably saw that same notice and were, wondering what does that mean for them individually and personally. And I think I know the answer, but I want to make sure that the Board of Health is briefed and everyone else involved is briefed so they understand where, how their both protected and what their liability is in you know, going forward when things like this happen, because I'm surprised I haven't heard from any of the Board of Health members, no concern has come through, so maybe they're all okay, but I was concerned about that. So, you know, I don't recall a message from Jordana on that topic, and I think it would be a good thing to keep everybody in the loop.
So, Greg, Jordana did reach out to Board of Health members, but she knew you were getting captured in the Board of Commissioners update. So we decided not to give it to you twice.
Okay, that's fine. Thank you. No, it's good to stay on top of that, and I do appreciate it too, because I think I heard about it. Actually, I heard about the suit from Kelly, and then I saw it in the paper. Nobody called me to ask about it, but it was kind of a surprise. But anyway, these things happen. We understand this. Thanks.
And Francie, I'm always available to help work through some of those chains of requests and things as well. And you and I think are going to get together and chat about some of that on a general basis, but you know, feel free to always reach out. Not that I know anything before you do, but I can help us all figure it out. Okay, John, I do have a question about the nonprofit funding here. Are we hearing any need for additional demands from our mental health partners? Will any of these be able to funnel money should that demand be out there?
Yeah, we are definitely continuing to monitor that, Kelly. In the immediate response, we have not heard the need for more resources at this point. It's been more the direct support for, you know, housing, food, loss of income, utilities, those sorts of things that have been the immediate pressures. But certainly happy to bring that back to our human services team and just see if they're hearing anything more on the mental health front.
Thank you.
As far as the business grant program, we are hoping to have a contract signed early this week with an application for business grant program later this week to early next week. We're still finalizing with ACF, but we're trying to do something that will both keep us in compliance with CARES Act funding, keep us in compliance with our fiduciary responsibility, but also allow us to move quickly and simply for the businesses as possible. So some draft requirements for the application is that business have filed a business safety plan, have no notice violations or closure notices for public health violations. This does not include warning letters. We do a lot of warning letters to help educate. We view that as, you know, trying to bring folks into compliance. By the time we're issuing a NOV or a closure notice, it's because there have already been several conversations about what the right thing to do is, but it hasn't happened. In terms of the business being in good standing, we'll just ask for a W-9 in that regard. And then we'll be looking for narrative and some financial information to understand how COVID-19 has impacted a business, what the estimated impact has been on gross and net revenues. I think as Francie has pointed out, in her business's experience, sometimes it's not the gross revenues, but the additional costs to deal with COVID that is hurting the business. And then demonstrated urgency and proposed use of funds. So we're going to try and get that through ACF into a really hopefully simple application format. One of the things that we did talk about at an earlier meeting, I had talked about having a $10,000 per grant upper limit. we got a lot of feedback, both from the folks who participated in the first round of the Community Foundation Grant Program, as well as from folks in the business community that particularly for the highly impacted sectors, those sectors, because they, the business that they're doing represents a higher risk of transmission, and so have higher degrees of restrictions placed on them through the public health orders, that we look at a higher grant limit, somewhere in the neighborhood of $20,000 to $25,000, which would shrink the pool of available grants, but would likely apply them in a more effective manner. Restaurants were obviously an area that were pulled out as an example of, you know, because a lot of their business takes place indoors with people from multiple households and necessarily without masks for good portions of it, there's a higher risk of transmission in those environments. And so there is a higher degree of restriction placed on those businesses, and we should potentially look at tiering a higher level of available grant funds. And so we'd like some flexibility with the board's okay to work with Aspen Community Foundation based on their experience to provide a little bit more flexibility to increase the grant amounts for those highly impacted sectors. And so I'll look for some discussion there. And then obviously, as we get the contract signed and we nail down the application process, we'll be looking for Aspen Community Foundation to bring their expertise to the table in reviewing those applications and making awards within parameters.
All right, questions for John on this grant program? Greg.
Yeah, hi, John. I've just seen in the paper today, there's a story about local businesses stepping up, like to help other businesses. I know an appeal has gone out to the local real estate industry. You know, we've had $3 billion change hands in real estate in the last year. And you would hope that people recognize the value of our dining, quite honestly, our robust restaurant industry as part of the attraction of this place to the very people who are buying these big, expensive houses. And I know appeals have gone out to industry to really pitch in, and I'm just wondering if there's some way we can talk about incentivizing them, whether through a challenge match with ACF or something, in order to prime the pump, hopefully to get the people who've been making a lot of money in recent times to you know, as part of our community to help out. Maybe there's a way we can challenge and incentivize. Just wanted to bring that forward as a discussion topic, and I don't have an answer yet, but I certainly would love to participate in something like that. You know, I think it's going to take all of us to keep us all going. Thanks.
John, did you want to comment on that at this time, or?
Yeah, no, it's a good idea, and the thing I'm trying to reconcile as we have these conversations is moving quickly and being creative don't always go together so well. And I know we're trying to move quickly to make these dollars available, but it is set up, Greg, to your point, in an existing fund in the Aspen Community Foundation that private donations can go to. And I think we could talk to ACF about potential opportunities there, even if it means us putting a few more dollars in for match or something like that. But I don't want to lose momentum to try and get something going here pretty quickly. I don't want to reconcile those two.
Point taken, but if you do bring up, I would have certainly encourage you to bring up the idea that perhaps we could participate in incentivizing as best we can. Thanks.
Steve, I know we lost you, so good to see you back. I don't know what you've missed. We're discussing the business grant program that we've been talking about for a couple months now. And so John is bringing us an update of how that would function and collecting some input. So do you have any input, Francie or Patty, currently at this time that you want to give John? No? Okay. Steve?
No, I think I'm good. My internet dropped me for some reason and finally got in on the phone and then the internet came back. So here I am.
John, you're muted. Did you want to say something?
Kelly, I guess just to do a check-in, it sounds then like the board is okay working with ACF and industries on being more flexible on those grant limits to be more effective.
I do have a couple of questions. You know, this is a grant program, so I just want to acknowledge there's always the hazard of, correct me if I'm wrong, you know, we could fund a grant and then someone could, you know, be subject to an enforcement or a violation subsequent, and there's sort of no recourse for that through this program. Is that correct?
Yeah, it'd be hard to have a clawback.
There's no clawback, okay.
I think mechanism, but I can certainly chat with ACF about
Yeah.
that.
You know, I'm okay to assume good intent and to honor past harm, I guess, past difficulty through these grants. And I guess another question I have is, how should the business community who is perhaps not a member of ACRA or has not otherwise been engaged through some of these sector-specific conversations over the last months, how should they be tapping into this program?
Yeah, so we will, certainly ACF will be getting word out through their networks. We will be making information available on our website. So, going back to the COVID-19 pickingcounty.com, we will be adding this under financial assistance for businesses so that they have a link to information and how to apply. So we'll also be trying to do some outreach on both individual and business resources through our comms team.
Okay.
So hopefully we'll reach those who are interested.
And when we initially started talking about this, we were looking at organizations with an employee cap of 25. Is that correct? Has that gone away?
Thank you.
Or,
thank you for bringing that up. We were surprised at how many local businesses that began to exclude. And so what we're encouraged to really think through is, allowing ACF to really look at the demonstrated impact and urgency. We're obviously targeting locally owned businesses, and that there is definitely some correlation. Smaller entities typically have less reserves or wherewithal to weather. And so we could put an employee cap on that still, Kelly, if that's the board's wish. There was, based on ACF's previous experience, a lot, particularly restaurants and such, because I think we tend to think in terms of full-time, but when you account for part-time and such, their head counts can go pretty high.
Mm-hmm. No, I understand that. And is that where the net revenue sort of percentages would capture, that criteria would kind of assess the most need?
Yeah,
okay.
Yeah. And so I think looking at, the sustainability of the business, and they're really trying to make an evaluation on two fronts. One, whether the grant is really going to help make a business sustainable. And so at these limits that we're talking about, those are really naturally going to be smaller businesses, not that ski company would apply for one of these, but you know, a $25,000 grant isn't going to make or break that business, but it might for a smaller restaurant and such over the next couple months or few months. And so it's really making those assessments is what takes the scale and size of the business into account, and that does get captured with net because that's your revenues against your expenditures.
Sure. So a couple other questions then. Will, you know, I guess I'll just couch my concern a little bit in a question. You know, I don't always know how these businesses are formulated, you know, what their sort of structure of whether they're incorporated locally or incorporated, you know, multinationally or something. But, you know, I do want to sort of ensure that we're really getting this into local hands. And so, you know, I have some hesitation about businesses associated with national, multinational conglomerates being able to access these. And I know, and like you said, there could be other functions of the grant that just make it unattractive or unavailable. But I don't know how we get at that concern. Is this going to be will there be an application term? So everyone who wants to participate, you know, has a period with which to apply, and then all these applications are evaluated, or will this be on a rolling process? Because again, I have some concerns about that too.
The recommendation is for it to be on a rolling basis until the funds are exhausted. And the reason for that was, one, ACF's initial experience was not as many businesses applied as they thought. And so having it on a rolling basis provided better assurance of broad coverage. It also allows for that word to get out and seep throughout the community versus having to cut off and folks who find out a week late being cut out of the opportunity to apply for grant dollars.
I'll just say my point, Greg, and then I'll go to you. You know, I guess I'm happy to rely on the, you know, experts sort of experience on this. I will caution that, you know, some of these things can advantage more organized, more professional organizations that in the whole scope may actually have less need than folks who just can't get it out the door as quickly or, you know, struggle with that, finding the resources to even apply for these things. So, you know, I just have some concern and want to caution that there perhaps is a trickling of the money out so that it does give the time for people who really could benefit from it to get in. And I just offer that because I've seen that with our CARES Act, with the CARES Act funding as well, and our reserve applications and things about who gets in and who doesn't get in and when, from my own experience. So, Greg, go ahead.
Yeah, thanks. Thanks, Kelly. I appreciate you bringing that up. I think one of the concerns I hear when we talk about supporting local restaurants, you know, with buying a gift certificate or, you know, financial aid of any sort, really, the concern comes down, usually the first question that's asked is, are the employees going to be helped by this measure? And so I want to make sure that, you know, that we're asking them, those are the tough questions. You know, if we're giving a grant to a business, you know, how are the employees that have been affected most going to benefit? And I don't know if there's anything you can add to that, John. I'd just love to hear things.
Yeah, and that, Greg, that's part of where we get into use of the funds and such, because obviously keeping people employed to the degree we can is a top priority. Understanding that these grants aren't necessarily going to make up for total revenue loss. And I also, you know, there's also federal programs that also tie employment. And so we really are going to be pushing just to round out the business support discussion. The Paycheck Protection Program applications, they opened last week. and it's now open to all Paycheck Protection Program eligible lenders as of January 15th. And then today is actually the first day that those lenders can submit first and second draw loan applications to Small Business Administration. For those who are interested, SBA.gov /PPP provides information on the program as well as how to apply for it. Additionally, there's another program through the Small Business Administration, Shuttered Venue Operators Grant Program. And this is part of the relief bill that was signed in late December, but we've definitely had a number of small venues that have been shuttered since the beginning of our public health orders and pandemic. So they do have a 50 full-time employee cap, but they can apply for fairly significant funding to help float those businesses through. The Paycheck Protection Programs in particular are tied to both maintaining employment and paying rent. Not all businesses qualify for those though. So we really encourage and are encouraging our business community to take advantage of these programs. We're encouraging those who are experiencing income loss or underemployment to really be seeking out help that's available locally. We are going to come through this. I really do think you know, we're going to get back to more normal levels of activity, but we do have 4 to 5 difficult weeks coming up here.
Thanks, John. This is probably the
No,
hardest
stop
part of the
there.
pandemic.
Yeah.
I do have a question. Will our Navigator will the Navigator program help facilitate the, you know, businesses that need some direction on where to apply to, or is that just related to individual economic assistance?
We are targeting both.
Great.
I do think they're different skill sets, and the state has set up a hotline through the office of OEIDT. I can't remember what that stands for now. They'll come to me in a second, to provide assistance to small businesses to apply, as has DOLA.
I think it's the Office of International Development and Trade, but I'm not sure.
That's it. Thank you. Well done.
Okay, Greg.
Yeah, I was trying to figure out where to insert this comment. One of the things just regarding assistance to the small businesses and their employees, at some point, I know it's not on the list for board reports, but I'm part of the Pitkin County biweekly food distribution team meeting, and I'm on the phone twice a month with Sam Landercasper, who coordinates it, and then people from all the various groups, including Ski Company and the schools and Lift Up and Food Bank the Rockies and others, regarding support and what's happening with food security in the valley, regarding both food collections from gleaning from whether it's restaurants or markets that have food that they can give up or are getting rid of, to the recent purchases. And I just wanted to give a couple quick reports. So if somebody's listening here and they really are in looking for help, Sam just found us a $100,000 grant to buy local food to support the food pantries. And that money, in addition to money that we've raised earlier in the year for Lift Up and others, is providing local food. And for instance, we got an email with photographs from Angela at Lift Up featuring the Wagyu beef that they purchased for the food basket. So anybody who wants it can take home on this weekly basis at least a pound or more of Wagyu beef that's provided, in this case, by the T. Lacey 7 Ranch. And it was amazing. The quality of the meat that they're putting in these packages is great. For those who need protein, it's a great thing. And I know Francie's helped and her company's helped with this in the past as well. But I wanted to say that we have a support network that's pretty amazing here, and I'm just hoping people know about it and can take advantage of it. So, thanks.
Thanks, Greg. Francie, hold on. I just want to check in. John, do you have additional presentation material? Because we're about 5 minutes out. You do.
Of course I do.
Okay. So Francie, do you want to comment now on this topic? I do want to move us along.
No, I'll write to Greg later. Thank you.
Okay.
All right, just want to go through vaccines a little bit. First, good news. Last week, we were able to provide 1,100 vaccines, primarily to our qualified folks, 70 plus, at our Aspen drive-through site. Little picture of that down here that is in the Aspen Times today. On the more challenging side, we have requested 1,500 vaccines for this week. We are currently not scheduled to receive any. We had originally had an allocation that we thought would allow us to give another 1,100 vaccines. That was based on the state assuming that they would get additional vaccines from the federal government to distribute. When we were made aware that was not going to be the case, and the state would receive the roughly 79,000 versus 210,000 that they're expecting, our allocation dropped to zero. And you know, really what the state is looking at is how other communities are doing and getting through their 1A and what we've come to call 1B1 priorities, which are the healthcare workers and our 70 plus folks. Now, the governor did make an announcement that the state was holding 40,000 doses for second doses, and that those should be released instead for first doses. And so it is possible that we will still get an allocation of some level through those 40,000, but we have not had confirmation yet. The good news is we have stood up a process that is very scalable. It is very effective. And we are able to restand it up quickly if we are offered vaccines this week. So, you know, good news and bad news there with vaccines. We're working with public health and the IMT with the 1B2, so those employers that have employees that have been identified as essential, to really work through a community prioritization there, because obviously that bucket is very large, and if vaccines keep coming in the way they have, we'll have to make priorities there. Right now, that through those discussions, schools, food distribution systems, essential public services like utilities and such are going higher on the prioritization list, but there's still some work to do there, and we'll be bringing that back out. The good news is, as a community, I think we're going to be able to establish some priorities versus just giving these up and not having a strategy, doing it more randomly. So more to come on that. But overall,
Patty
I
has a
think
question for you,
picking
John.
count- Oh, sorry. Yeah.
Patty, you're muted.
You keep using my fingers, and my fingers don't work on this screen. It's like so confusing. Anyway, real quick, I heard on the news this morning there are some states, I want to say Florida, but I'm not sure, where like 40% of the people that have been vaccinated are not coming back for their second vaccine. So I think we need to be really clear. And with our program, we really emphasize that with people. I'm sure we are, but we need to overemphasize because it's kind of becoming a national issue. I think the other thing that's positive about ours is people have had such good response because it's been handled so well. I cannot thank the people, John, you, and everybody for this great accomplishment. But we need to make sure people get that second vaccine because that's what makes the whole picture a picture. So we really need to push that out there. Thank you.
Steve, go ahead.
Yeah, I went through the process there in the Music Tent parking lot, and I was very impressed with it. I'm concerned that if someone needs to arrive on foot, that it's not really set up for people arriving on foot. There are people in town who don't have cars, and I'm thinking at the senior council meeting tomorrow, I will suggest they maybe set up a volunteer driver thing who could pick up people over 70 who don't have a car so they can go get their shots. That would be one possible way to get people delivered. But maybe we need to set up a walk-in part in the parking lot, in the tent there, for people who live in town or who come on bus who don't have a car. And maybe when the weather gets warmer, that will work better for other parts of the population. I'm also concerned about the large number of people not getting their second shots because that reduces the efficacy of the first vaccine. You don't have that much immunity built up. So we really need to track that also. Thank you.
Okay, John, did you have comments on this?
Yeah, the only thing I would add is for the logistics, there's probably going to be some additional budget requests coming to make this sustainable. We've right now been funding the effort through the contingency or emergency contingency that was budgeted in the manager's budget. The good news there is we did receive notice of additional CARES Act funding. They've now awarded our full amount of our second request, so that's just below $400,000 in additional funding there. And we're anticipating that there's going to be a second round of federal aid given how the elections went. So I think there's going to be funding readily available. I think as vaccines become more readily available, expanding the reach of our vaccination program is also going to be important. So at any rate, it's a good start. We are prepared. As soon as we get vaccines, we will be getting them into arms. We're scaled to do it, and I think so far, based on the feedback on balance that I've gotten, it's going well. So, yay.
All right.
And that's it.
Thank you. Let's try and wrap this up, but let's give time for additional discussion. Francie, what was your question? I don't think we can hear you. Can you hear us, Francie? Did you want to raise your question now?
I think she's trying to unmute.
Yeah.
Okay. My question was, I've been doing a little bit of research, and I asked Andrea, Greg, about whether there is a food kitchen, a soup kitchen in the valley. because we have a whole lot of meat that we want to give to a soup kitchen that wouldn't be appropriate for distributing to families because there aren't enough packages of it. So, does anybody know?
Greg, go ahead.
Francie,
Yeah.
you know, there used to be efforts through the homeless shelter. I think a lot of the soup kitchen efforts and such have been discouraged during the pandemic, but there isn't in Pitkin County that I'm aware of. Greg, unless you're aware of anything, now there may be in Glenwood. So we've been relying mostly on the food pantries and distribution for those needs.
You're muted again, Francie.
Greg, I may have missed something.
How does that help homeless people if they don't have a kitchen?
So we've provided a safe outdoor space to try and provide those facilities in a safe way, and for the homeless community to be able to take advantage of the food pantry. For those who have not qualified for that, I know the homeless shelter has distributed camping gear and those sorts of things in the past. But you're right. I mean, it's not providing a hot meal, that's for sure.
Thank you.
I will know, I don't know, Francie, if I can be helpful, but, you know, the Aspen Chapel, in coordination with the homeless shelter, organized a Martin Luther King Day kind of meal drive, where people were asked to make freezer meals to bring over to the homeless shelter that they then will provide at future dates to offer hot meals. So if that's helpful at all, I'm happy to kind of help coordinate who might be able to use that donation and siphon it through
I'll
that way.
check in with you by email a little later then.
That sounds good.
Thank you.
And then before we move on from COVID, I just want to mention, you know, I think I also want to acknowledge there's a lot of housing assistance funding that is going to be very quickly coming into the pipeline. And, you know, I'm sort of connected to that effort in terms of moving it from the federal government down locally. And I know Nan has raised some concerns about local uptake for some of those programs. So I want to keep that on our horizon, because I don't want us to leave resources that could help our community, you know, on the table, and you know, figure out how we can incorporate this into our efforts. You know, we've donated money directly for local landlord assistance, so maybe an update on that as well. And then, you know, I just want to make sure that people aren't falling through the cracks in terms of being able to pay their rent, pay their mortgage, because there is funding, and there will be more funding. And, you know, I do think the state is trying to figure out ways to readily and easily get that money into the right people's hands. So, John, I just want to flag that as a topic that I think we should incorporate into these updates and into our financial assistance program offerings. And I'm happy to, you know, do whatever I can to figure out how we do that.
Yeah, Kelly, no, and we should have more conversations. That's certainly a big focus of the Navigator program, certainly taking advantage of the property owner protection funds that are coming down that, you know, allow landlords to apply to cover rent for tenants who are unable to cover because of COVID-related losses, as well as others. And we do have a lower uptake here. We could certainly leverage those funds a lot better in our community.
Yeah, and I know there's, you know, 50 million coming into the state. So let's keep that high on our list. And again, I'm happy to figure out how we best get that into the hands of our community members. So if that's it on COVID, let me just do a last check-in. Any other COVID conversation? Okay. Moving us along to our board membership reports. We have 20 minutes before we'll break for an hour lunch. I'm first on the list, so I guess I'll start. Let me pull up my notes. So regarding APSHA, you APSHA, I think, is very diligently moving along on our strategic plan and work plan, which is the first time we've had those, that were created last year and adopted by our various boards over the summer and fall. And so some of that is related to policy updates and, the regulations, the rules regarding APSHA, criteria, qualifications, enforcement, things like that. As many of you know, APSHA restructured the enforcement program to hire a hearing officer so that enforcement issues go to the hearing officer first before they could be appealed to the APSHA board, and so that frees up time on APSHA's regular meetings to really be focused on the policy stuff that APSHA should be focused on. And so there will be a survey that is going out on some policy topics, and this is designed to be a statistically valid survey. Again, seeking input on topics that I'll run through briefly, but this will be sent out to APSHA's internal list, so the lists of all the homeowners and tenants that they have, as well as people who have been actively bidding into the program, property managers, HOA contacts. So APSHA has a pretty robust list for that, and then there will also be links available for the general public and for policymakers to provide feedback in addition. So I just want to run through, in case you hear some individual feedback in your conversations from folks on what this survey will contain. So there will be a question about the ownership exclusion zone. So when you apply to purchase an APSHA, you can't own residential property in Eagle, Picken, Garfield, or Gunnison counties. And so there's a question about should that ownership exclusion zone be expanded? So should people be allowed to own property, say in Denver, residential property in Denver, and still be allowed to qualify for housing in the APSHA inventory? Another question is related to the dependent age of children. Currently, dependent ages of children can go up to 24, and so that allows people to qualify for a larger number of bedrooms. So the question is, should that number be reduced down to, say, 19? So perhaps when children leave for college, they no longer would qualify to be counted in the family unit size for the number of bedrooms that somebody may qualify for, an applicant may qualify for. There's a question related to custody duration. So, is part-time custody, does that allow you to qualify for a larger unit size or not? A salary requirement. So currently there's not a minimum income earned requirement if you wanted to purchase a unit. And this question's being asked because staff learns a lot of folks who maybe have overextended their ability to purchase and find that HOA expenses, capital improvement requirements, monthly requirements to pay into that, overextend folks who have purchased into APSHA. And so putting a minimum earned income may help address and acknowledge that there is additional expenses with home ownership. Lottery chances. So currently, if you live here for 20 years, you get additional lottery chances for every 4 years that you've lived here. Should that be broadened? Should you get more lottery chances on a unit if you lived here for 30 years or 35 years, or should that 20-year cap remain? And this is stuff that's really getting into the weeds. I can tell all of your interest. I do want you to know and just be informed before it goes out. And then there's some questions related to, let's see. oh, if you are a college graduate and you've gone away, you grew up in the Roaring Fork Valley, you've gone away to college, you've now come back and you're seeking to live and work here, what your lottery chances should look like. So currently you're allowed to be given the 4-year priority if you had lived here your whole life and went to high school and then went away and came back. So there's some questions related to that. And then I just want to note that these are sort of the more minor policy discussions that are going to happen. We're still undertaking larger policy discussions related to capital reserves, things like that. But these are topics that we thought we could get some information in a survey to advise the board what direction the conversation should go and how much interest there is in having a broader public outreach process on those policy topics. So that will be forthcoming. I don't remember the exact date that is going out, so my apologies. Yeah, Patty? You're muted. Yeah, Patty, I see you. You're just muted. Okay.
Excuse me, I know
Okay,
I'm
okay.
muted. I mean, I know I'm figuring out how to get unmuted. You gotta give me a break. I had asked about a consideration of health insurance from an income cap.
Mm-hmm.
Did any discussion come about on that? Or can we bring that back up again?
Yeah, I can bring that back up. There's sort of a running list of policy topics, and the board identified which ones we thought we should tackle more immediately than others. So I can just make sure that continues to be on our working list.
Okay, thank you.
You're welcome. Okay, and then I'll move on to CCAT, so Colorado Counties and Commissioners Acting Together. Francie, this is one of our statewide legislative membership groups that as a county, we've elected to be part of and we pay dues to, and they actively lobby on our behalf. I don't have a ton to report right now because the legislature is not they're not starting session until February. And some of the housing stuff is part of my role in CCAT right now. I'm on their housing subcommittee. So we'll be working with the state and DOLA and the Division of Housing on how to funnel through that additional federal money that's coming in for housing assistance and the programs that John and I talked about, as well as some additional legislation that we expect to move through the legislature. I will note, I don't know if I reported this out, but a bill regarding inclusionary zoning is CCAT's top housing priority this year, and so this is something that has been discussed for many decades, and it was ruled out by a Supreme Court ruling called the Telluride case in 2000, and it prohibits jurisdictions from requiring that developers actually build a certain proportion of affordable housing in concert with their larger development. So we've sort of worked around this with fee in lieu and with housing mitigation fees, but this would change the requirement to actually say hey, if you're gonna build a 30-unit multifamily, a certain portion of that has to be built for affordable housing. And so it's moving forward. It's a prospective program. It doesn't go back and look at construction that's already built. So we'll see. There will obviously be there's a lot of interest around it, a lot of supportive interest, but there will be a lot of contention too. So to be determined. And then on the 1177 roundtable, that's the Colorado River Basin roundtable. Our first meeting of the year is next week, so I don't have a ton to report. I do want to continue to put out my interest in trying to convene a kind of ag water users group of sorts. I could use some help in trying to figure out what that looks like, because we're in the process of updating the water plan, and I don't think we have enough information to validly represent our ag needs here in the county. And I've taken up a lot of time, so I apologize. And we'll move on to Patty's updates.
Okay, I'm not muted, right?
Nope.
Okay, ACRA meeting is coming up the end of this month. Northwest COG meeting is next Thursday, along with Economic Development. The Basalt Vista Homeowners Association, just so everybody knows, they were able to tweak some of their units, the sizes, bedroom sizes to accommodate the needs, because they've learned as the process moves forward. They're excited, they're moving into next phases, they have more homeowners moving in. So some of the bugs are kind of being worked out, the bugs that we saw when we first started with APCHA and unit size and who could apply and all that. So that is moving in a positive direction. And I have not yet met with Brian Pettit for the TPR, the Intermountain TPR. But hopefully Brian and I will be setting something up so I can be ready to facilitate with him on that board. So that's it for me.
Thanks, Patty. Steve, you have any updates for us?
Mostly about just upcoming meetings. Virtually everything is having upcoming meetings. So CCI is having the first legislative update this Friday. The legislative committees are meeting next week on Thursday and Friday. The legislature is not in session right now. They were in session for 3 days and then adjourned until February, sometime in the middle of February. So there's actually not a lot going on aside from the Joint Budget Committee is meeting regularly during this break period. Likewise, the RTTC, the Regional Transportation Committee, only meets about 4 times a year, so that will be a while away. That's a Northwest COG subcommittee. The RAC committee, the Regional Advisory Committee for Vintage, is meeting tomorrow morning, and so I'll be at that meeting, as well as Senior Council tomorrow afternoon. So tomorrow will be a day for senior issues. The main issue I see with Senior Council is Senior Council has trouble keeping membership because they have term limits. People serve for two-year terms, and then they are term limited. They have to take a year sabbatical. Many members come back after that year, but they don't always, and so it's a never-ending issue losing members who are very active. Like right now, Amy Throm is the chairman of the Senior Council, and come March, her term will end. She'll be term limited and then can no longer participate for a year's time. We don't know if Seth Saxon will come back, because right now he's on his sabbatical year. So the Senior Council is struggling with trying to keep a higher number of members, and they're trying various ways to just inviting people to come and participate in the meetings to see what it's like, or various things. I personally think maybe the term limit part of the bylaws should be eliminated and let people serve as long as they want, because it's really, I think, the only citizen board we have that has a term limitation on it. Club 20 is having on Thursday and Friday, it's called Voices of Colorado Legislative Conference, which will be, normally they meet at the Capitol and meet with legislators. This year it will all be virtual, and it's not only Club 20, but a whole bunch of different organizations across the state that represent rural parts of the state will be participating in that. I've never been able to go to this thing in Denver before because it's always been on the same day as CCI legislative meetings. And this week it happens to be a week off, so this will be my first opportunity to participate in that. And then Club 20 also coming up. The big thing in the wintertime are the winter policy meetings. So it's 2 days in February and 2 days in March where the different policy committees get together, and that's really where the nuts and bolts of Club 20, the part where I can have a big impact on changing the policy in those policy meetings. So that's a month off right now. And so that's all the report I have, all these upcoming meetings, and nothing has just happened.
Okay, thanks, Steve. And Greg, to you?
Okay, all right, let's see how much we can squeeze in here. CC4CA, Colorado Communities for Climate Action. The thing that's first on our list is locally is that CC4CA is outreaching to town of Snowmass Village to see if we can get them to join. CC4CA has, I'm trying to remember, so it's over 40 plus municipalities and counties in the state are part of CC4CA. One of the things that we're working on, they're developing right now, are getting ready to submit comments for the March 31st greenhouse gas inventory requirements public hearing, which is in March 31st, which is with the state board. An interesting thing that comes up is that we have emissions targets for 2025 to be 27% less than 2005 and 91% less by the time we get to 2050. And these are really great ambitious goals that have been set by the state, but it's going to require, as we point out, it's going to require legislation, regulation, and policy in a big way for something really to come of it. But the group has been growing members with elected boards from around the state, and I'm enthusiastic about CC4CA. Next one on the list is CORE, Community Office for Resource Efficiency. We have a new board chair. Bill Sterling has become elected as the board chair. Dave Monk from Holy Cross Board, longtime local in the Valley, is the vice chair. And at the last meeting, there was a discussion regarding some new ventures for CORE, because as REMP funds are diminishing, CORE is looking for other sources of funding. So we're going to be having fundraising meetings. I'm on the funding committee. There were some innovative ideas for actually creating a building, a company that could do some, state-of-the-art efficiency building, which unfortunately failed. But innovative ideas are happening. Currently, there's an art exhibit, and they're soliciting your faces and faces from the community to be part of an art exhibit that CORE is doing, Faces of Climate Change. And if you're interested in that, you can go to the CORE website. Regarding QQ, let's see, QQ, just what's come from QQ recently. We haven't had a meeting recently. We've seen presentations on detailed climate projections for the Colorado Mountains, temperature surveys, where we're going with temperature. We've seen articles advocating for suspension of irrigation in western Colorado in order to meet the demands to keep Lake Powell's levels up, which is pretty shocking to hear that, but it's a conversation that needs to be had. There are conferences on oil and gas rulemaking and how they affect water quality and quantity. And then finally with QQ, I'm sure there's more, and Kelly may have more on that, but Karen Stiegelmeyer, who is a great water advocate, former county commissioner, term limited out, is leaving, and she's been such a great influence in water and environmental issues in the state. She's one of our commissioners who's outgoing, so we're saying goodbye to her. I know 3 of us on the board are going to go to the Colorado Water Congress annual convention, which is virtual on the 9th and 12th of February. Topics for that: ag transfers, buy and dry, water for the lower Arkansas River, how this economy is shaping financial decisions for water managers, forest health, water quality, and then Colorado River demand management. So it'll be an interesting conference. Looking forward to that. Regarding Board of Health, I think we had the report from John, and I mentioned just, I think, it's great to see what we have available to help the community, but certainly more help is needed. I wanted to get to RAFTA. RAFTA has a new chairman. It's Dan Richardson, the mayor of Carbondale, is the chairman, and Bill Kane, our mayor of Basalt, is the vice chair. At our last meeting, which is last Thursday, we had an update on the Destination 2040, which was the big goals that were funded through the issue at the last election. We had news that Holy Cross Energy purchased RAFTA's shares in Clean Energy Collective solar panels, which Clean Energy Collective, as we know, went bankrupt, and so they had to dispose of the the assets, and all the members were kind of left high and dry. So everybody was involved, ended up selling their solar panels at a loss. Holy Cross is picking them up and will be putting them to good use. Ridership during COVID is down 50%, but bus mileage is only down 15%, and employee hours are down 12%. So revenues and expenditures are being monitored carefully as revenues down and expenditures are still going up. Being the largest rural transit system in Colorado, we're expecting to receive a significant amount of federal bailout funding. So the board and staff are confident. We've got a great staff. Dan Blankenship, the leader of ERAPT, has been so solid for so many years that I think everybody's very confident they'll have the financial ability to weather the economic fallout from COVID despite increasing costs. And some money has to be shuffled around. I know some of the bigger projects have to continue while others are going to be pushed back, and I can give you more reports on that. But, I'm always come away very confident after a report from Dan Blankenship and the RUAFTA board. Regarding RWAPA, I know just for us, April Long did have a meeting with John Ely regarding the IGA with Pickton County, which got held up, quite honestly, for way too long, maybe 8 months. And it turns out that there wasn't really too big an issue. We just had to insert some language about consensus in decisions for RWAPA, and I think that satisfied John. So that's going to come back to us. RWAPA is developing models for the Farang-Pan River, as we know, is an economic driver, and it's a cultural fly fishing mecca. And so care for the river ecosystem and the fishing industry concerns are occasionally in conflict. And so I know RWAPA is working on that, as well as the aquatic nuisance species program, which has really been the most successful of all the reservoirs in the state. RUDI has been able to keep the quagga mussels and the other zebra mussels out of RUDI so far, and so we're doing well. Regarding BLM and U.S. Forest Service, I have nothing to report yet because I haven't been involved yet, but we'll be reaching out when the time comes. That's it for me. Sorry, I went over.
It's all good. We started late, so thanks, Greg. And Francie, I just want to offer, I know you're an alternate designee, but you're always able to chime in on any of those boards that you're the alternate for, because we all tag team. So feel free to report out.
Well, I did talk to John Ely about the Colorado River Conservation District for quite a while yesterday, tried to get a little bit up to speed, and also wanted to reassure him that I'm not trying to report on what he should be reporting on, and we agreed that it would be ridiculous for me to report on anything today. So, but in terms of RUDI, I do want you guys to know that it is frozen over, it's crystal clear, and there are people skating on it. It is spectacular. It's like a once-in-a-lifetime experience. My grandkids have been up there a lot, skating their hearts out. So if you haven't been, you should go, because it is really something.
Thank you. Okay. Thanks for getting through that, everybody. We're going to take an hour break. We will, a little bit less than an hour. We'll reconvene at 1 o'clock for our air quality study presentation. So thank you. See you at 1. Thank you, Grassroots. welcome back everyone to the Pickens County Board of County Commissioners work session on Tuesday, January 19th. We will move on to our afternoon agenda here, and the first item is presentation of an air quality study we had commissioned last year. And I will ask our Community Development Director, Cindy Hubin, to kick us off and introduce her guests.
Hi. Oh, great. Thank you very much. Yes, I'm really honored to be here today with our air quality experts who've helped us with this study. And first of all, I'd like to introduce Howard Gebhardt, who is our air resource specialist consultant who did the work on the volatile organic compounds. And then Andrea Holland, who has helped us through volunteering. Andrea is an air resource specialist who formerly was with the Forest Service and also still contracts with the Forest Service, primarily does a lot of work on wildfires and has really helped us with the identification of or analysis of information from another group that we consulted with, APIS, that had air quality monitors as well, and we'll get into those details. And Greg Harshfield, who is with the Colorado Department of Public Health. Unprecedented amount of time he has given us to help us with this project and help us analyze some of the data. And Greg is going to give us a deeper dive into some information on benzene and how that looked during our study period. I also want to thank Jeanette Whitcomb with the City of Aspen for really participating, being a part of this. Jeanette's the air quality specialist with the city and operates their program that they have in the city, and we'll talk a little bit about the monitors that we use to compare some of the data with the City of Aspen. So with that, also want to thank Rich Engelhardt for being here. He started helping out, looking at some of our data, asking good questions towards the end of the process. This was pretty much an independent process, independent from the airport, but I did have to reach out and ask the airport for some help. We had, as you know, the monitors and sensors were located on top of the North 40 fire station. I really want to thank the airport team for helping out with all of that, because you had to climb up the fire ladder to get to the roof, and there was no way I was going to do that. And I'm afraid of heights. So these guys from the airport jumped in, helped out, got up on the roof every 24 hours to ensure that the canisters were working well for our 6-day period in June, July, and June, and then also in September. So really want to thank them for all that help in that regard. So with that, I'd just like to mention a little bit by way of introduction about the study. Number one, we're very fortunate and thank the commissioners for finding the funding to do this snapshot study with us, because we know the demands on the funds right now with the county are really great with everything going on with COVID. So we appreciate the opportunity to have at least kicked off this initial study. We know that this is a snapshot study. It's not complete data. As Jackie Francis said to me, incomplete data is bad data. But in defense of that, we knew that this was not a complete study, and we've never said that it would be a complete study. We know that additional work needs to take place, and hopefully we'll wrap up with that towards the end of the presentation. We know that having the monitors in different locations and looking at different times of the year, different seasons, different durations, would all produce different results. And we understand that. Is something that we will deal with in a more thorough planned out, programmatic way of looking at emissions from the airport. But we also want to note that this was a study focused on health. We focused it in the area where there's the greatest concentration of long-term residents versus short-term come-and-go areas of around the airport. So that was the focus of this study. It was also focused on the health impacts of these pollutants and these air quality parameters. It was based on EPA standards and not based on greenhouse gas emissions or anything of the nature that we may be looking at, or hopefully will be looking at in more depth as we do more research further on the airport. We also want to point out that we didn't ever assume that this was going to be the only project done. This is a one-time short-term project that hopefully will provide us with a little bit of baseline data. And it did illuminate a lot for us as far as, I think, understanding at least the beginnings of what we need to do as we move forward with a bigger program on air quality. And once again, thank you for everybody who participated. And we're going to start off with Bonnie is here from my office, Bonnie Shouts, and she's going to help us with any of the presentation materials that we might need. Howard Gephardt's going to start. He did the main study. And as I said, we had two consultants. We had Howard, and then we also had the monitor equipment put together through the APIS consulting firm. So Howard's going to start with his data and follow with her data relative to the APIS work. And then Greg is going to follow up with a deeper dive into benzene. And then hopefully we'll have a broad discussion on what the board would like to talk about. So Howard, if you don't mind kicking us off with your presentation.
Sure. I'll give Bonnie a minute to load up the PowerPoint slides. All of the PowerPoint slides that are here are excerpts from the written report that I prepared. And so we'll just jump right into it. I think I'm going to try to be as brief as possible because I think it's going to be more productive rather than for me to espouse what's going on, for us to have a more detailed discussion and question and answer session. So why don't we move on to the first slide. This is a picture, again, it's from my report. It just outlines the general study area where we collected the data. It shows the fire station across the street from the airport. And then some of the other things that we did in our study in terms of looking at the airport was we wanted to identify potential other sources of air emissions that would be in and around the neighborhood. Those are tagged on there, such as the service center for the transit system, the consolidated sanitation district site. There is a filling station that's immediately adjacent to the fire station that potentially creates emissions. And then also adjacent to the filling station, it's a signalized intersection on Highway 82 where we can get queuing of traffic and emissions. We were focusing on the North 40 neighborhood area, and we picked the fire station because it's sort of at the front end of the neighborhood in relation to the airport. And the closer one is to the emission source of interest, there's a higher probability that we're going to find emissions associated with that source at that location. So the fire station provided us an opportunity to be at an area where we could secure the equipment being on the roof. There was nobody could interfere with the measurement collection while it was going on. And it's also at the front end of the neighborhood where if there is impacts into that neighborhood from the airport, it would be expected that we would see that at the fire station. And so that was kind of the rationale and the basis for picking that particular site. Next slide. The study method that ARS did to collect volatile organic compounds is called EPA method TO15. And it's an official EPA testing method. And what we do is you see a picture of of some of the sampling equipment. The canisters that are there, each one is run on a separate day. We have a timer system that switches from day to day. And the air is drawn into and collects in the canister. And then at the end of the study, we send the canister off to a laboratory, and the laboratory does the analysis of the samples to return what the data is. And it's an official EPA testing method. It's focused on air toxic emissions that are present in the atmosphere. And it collects, I believe, 60 to 62 or so different BOCC compounds are analyzed for. And so we can get results for as many of those as are detectable in the sample. Each of our samples ran for a 24-hour period from midnight to midnight the next day. And the timer switched off the sample, turned on the next sample, and it just cycled through for the 6-day event for each study period. Next slide. So we did a study in June. These are the results for the June study period. The units are micrograms per cubic meter. And on the slides, I've only presented those compounds that were detected above the minimum detection limit of the analytical method. In June, we set up on Monday, so it started at midnight on Tuesday morning and ran through midnight on the following Sunday. So each one is a 24-hour sample, and the Tuesday sample starts and the Tuesday sample ends and the Wednesday sample starts, and so on and so forth. So there were over 60 compounds that are potentially detected, and in the June sampling period, we only collected a handful of those samples, and even some of those samples, like if you'll notice the hexane, which is the 1, 2, 3, 4, 5th line down, was only detected in one of the 6 sample days during that period. On the far right-hand side is the RFC, or what is called the reference concentration, and that's the data that we've used to assess the health effects. And I'll discuss, we have a slide later on that talks about what the reference concentration represents, but that's a concentration that is established by EPA to help determine health effects of these different compounds. Not all of the compounds that we tested for have an RFC. The next slide is the September sampling, and in September we detected more compounds than we did during June. Now, part of that is due to the fact that the September events appear to have been also affected by the potential for wildfire emissions in the area. That was kind of when things were starting to go with the fire in the Glenwood Canyon. The other thing that's interesting about September and why we picked that time period is that for the first 3 samples in September, the airport's actually closed and is not operating, and there are no flights in and out. And then the airport reopened on Friday, September 18th. And so hopefully the idea here was if we could determine if there were airport effects, we would likely see those in differences between what was in the samples from when the airport was open and when the airport was closed. But in reality, we don't really see a large difference in the concentrations of the different pollutants between when the airport was open, when the airport was closed. We have some data later on that goes through some of the operating parameters and shows how many flights and things were at the airport. The other thing again, we're focusing on the health effects, and the numbers are far below the reference concentration where there is a reference concentration for that pollutant. Next slide. So this is actually the definition of what the reference concentration represents from the US EPA. And I'll just read it. It's an estimate with an uncertainty spanning perhaps an order of magnitude of a continuous inhalation exposure, air that one would breathe, to the human population that is likely to be without appreciable risk of deleterious effects during a lifetime. So it's kind of it's the EPA standard, for lack of a better term, that defines for different toxic air pollutants whether or not one might expect concentrations to have significant health effects. Next slide. So I wanted to talk a little bit about some of the operational data. Part of the reason we started in June was that we expected that the amount of activity due to the COVID was perhaps less, and we do see that in the traffic data. I've compared the 2019 and 2020 traffic counts. This is the traffic count data on Highway 82 at Cemetery Lane, which is a little bit closer to town compared to the airport. But the information here shows that during our 2020 study period compared to 2019 in June, it was about a 20% lower traffic volume.
Can I just jump in
running
here
down
real
highway.
quick? Sorry, Howard, sorry to interrupt you. I was going to ask Bonnie if she could zoom in on the slides or choose like a slideshow mode or something.
Yeah, sorry, not quite certain how to get into it then, I'm sorry.
Bonnie, if you could try F11 on your keyboard, that may do it for you.
No, sorry, it didn't.
Okay.
Bonnie, if you go up to the top menu bar, you'll see slideshow, and if you click on that, it should make the graphs larger. Just say from current slide. Oop, maybe not.
Sorry, we'll get this figured out. No, I don't have any tips for you, Bonnie. Terry, do you have any tips for Bonnie?
Actually, maybe show thumbnail. Nope, that's not it, sorry.
Sorry, let's try this again. Bonnie, can you put your slideshow back up? You might just need to escape from the view you were in. There you go. All right. We'll work through it. Greg, can you find in the packet, this information is pulled directly from the packet? Okay.
Yeah.
Sorry for the interruption, Howard. Thank you.
Anyway, everything in my presentation is also in the report. And it's also, I provided the slides in the packet as the PowerPoint, which I believe was distributed. Anyway, getting back to the
A1. Exhibit A1.
Hey, Bonnie, also at the bottom, there's a little slide at the bottom. You see where it says 102%? There you go.
Anyway, so this summarizes the traffic data for the 6-day study period during June and also during September. The main thing I wanted to point out is that for the traffic counts on Highway 82, the June study did indicate that the traffic counts averaged about 20%, a little less than 20% under what the 2019 counts were for the comparable period, and that overall during the month of June, there was about a 12% decrease in traffic on average. During the phase 2 study, which occurred in September, the traffic counts between 2020 and 2019 are more or less the same and not really statistically significant. So, to me, the 2020 traffic emissions associated with traffic would be expected to be close to normal. The next slide is similar data for the aircraft departures from the airport. And I think we were hoping again that in our June period that there would actually be somewhat lower traffic than normal, but we did not find that, at least from the terms of the aircraft departures. The 2020 data for the June period and the 2019 data are virtually identical for the 6-day study period within 4 of each other. And then in the 2020 period in September, you'll see that again, the airport was closed for the first 3 days. And then on the Friday, Saturday, Sunday, the traffic was probably a little more than normal, and I think that would be expected. There's probably some makeup of the fact the airport was closed. There was going to be a little surge in the air traffic coming and going during the last 3 days right after the airport reopened. But you can see that if there was a significant signal from the airport emissions, we should probably be able to pick it up between the 3 days in September where we had the airport closed versus when the airport was open and seemed to be running at a higher than normal operational rate. Next slide. The last slide I have for my presentation is just a depiction of the weather, the wind roses. And so what this depicts is the direction that the wind is coming from. And so on the left-hand side is the wind rose for the 6-day study period in June, and on the right-hand side is the 6-day study period in September. The wind patterns are generally the same. The most dominant wind is from the south-southwest, and there's a secondary maximum again then from the north. The north winds are a little more pronounced in the June study period versus the September study period, but I think this is entirely expected in terms of the orientation of the terrain. The winds kind of blow up and down the valley, and we're seeing that in the wind data. This is the wind data from the airport weather station, again, for the 6 days in June and the 6 days in September. So that is kind of a brief summary of my presentation, and I think we'll go on to some of the others, but I'm more than happy to come back to any topic of interest to the board and discuss that in more detail later.
Let me check in with the board to see if there's any clarifying questions at this point. Greg?
Yeah, thank you. I do have some questions. I'm not sure if they should wait or not, but I can just tell you what they're about. One is, since we didn't do this study in the winter, I'm just familiar with the complaints I get from this part of the valley where I am, in Woody Creek. The complaints we've heard been about people who go out and cross-country ski on their property in winter, and they get this really intense scent of jet fuel, or they're assuming it's jet fuel. It's kerosene, which probably smells a little different, but I'm not sure. Maybe it's highway emissions, but that's one of the biggest complaints we've had and concerns. And additionally, we have those concerns at Buttermilk, where the engines are warming up or where they're taking off. This Buttermilk ski area base, there are times in the winter when it's, you can almost feel the emissions. It smells pretty bad there, and people are concerned. And so what I'm hoping the questions I would have is, really what does this tell us about aircraft activity at our airport year round, even during a pandemic? And the VOCs, I assume it's VOCs, are noticed at Woody Creek and Buttermilk. And then also, what about the traffic? I don't assume the wind direction changes that much, but maybe it's more intense if we get temperature inversions in the winter.
I think,
yeah, so.
Answer your question about wintertime, I think what could be happening in the wintertime that we wouldn't have picked up during our June and September studies is you get sort of a trapping of the emissions with these wintertime inversions. And so you can get an accumulation of emissions over a longer period of time when the air doesn't get a chance to sort of escape from the valley and recharge, for lack of a better term. And so oftentimes wintertime inversions in the mountain valley setting can produce higher concentrations than you would expect at other times. Part of the reason for doing this study when we did it was we were hoping to get a signal of when things were at lower levels of operation versus normal levels of operation, and use that as our indicator for the signal. With this data that we collected, we were not able to distinguish a signal in the data that I collected from the airport that would point a finger saying the airport is the cause of something. And then furthermore, even whether or not the air emissions come from the airport or some other location, during our study period, we found that the concentrations that we were measuring were well below any health-based criteria that we could use for comparison.
Right. Thank you. If I could, just to follow up on that, the other part of my question was, do we have any data on fuel dumping from the airport in particular? I don't know if vehicles are dumping fuel, but certainly aircraft do at times. And they try to do it at high enough elevation that it dissipates. But I was just wondering if we collect data on that. And then also at elevation, I think fuel isn't consumed as efficiently. And that goes for diesel trucks as well as for aircraft. And I'm just wondering if that should be part of the conversation as I understand it. And I've seen a lot of data that says, this really isn't harmful, but it's hard to tell that to somebody if they feel as if they're suffocating with jet fuel. So I'm grateful that we're going to continue looking at this and maybe figuring out ways we can, I don't know if we can mitigate it until we get to electric aircraft. Thank you.
Yeah, Greg, I think we'll cover the difference between what we were doing with the EPA public health standards and then that of odor, which is, it's a different thing. It's totally a real, something that's very real. I mean, we've all smelled it. It's all there. But this study really indicated more about the public health standards. So with that, if you don't mind, Kelly, maybe we'll move forward with Andrea's presentation on the APIS data. Thank you.
Sure. Thank you. Thanks, Andrea.
Okay, I'm going to share my screen here. Oops. I know it's in here somewhere.
As she's getting that done, Andrea put in so much time on this. She is volunteering for us, and really, really appreciate all of the work she's done. So thank you.
Oh, here it is. Ta-da. Okay. And there you go. All right. So just wanted to, I basically, APIS set up the sensors, and they do not grind through data. So I volunteered, like Cindy said, to grind through the data and provide a summary of what the sensors showed. And APIS basically set up sensors to look at particulate matter, nitrogen oxides, and ozone. And you probably notice I'm using the word sensors. They're not monitors. They're not federal reference monitors, which are a lot more expensive and require a lot more
quality control, quality assurance to operate. But they do provide a gist of what's going on with air quality. So they're low cost, and that's a benefit, but it's not something that you can use unequivocally to determine compliance with National Ambient Air Quality Standards, or NAAQS. So bottom line is we didn't see any exceedance of those NAAQS. And I have to also add that the sensors typically overestimate the air quality pollutants, so that's good. You know, the sensors, other than ozone, which I can get into a little bit later. Just another couple other things. There was the particulate matter data set for September. For some reason, that sensor didn't operate except for 6 days. That particular sensor can be a little, sometimes they just go off on their own and they just go out. So anyway, we only have 6 data sets for September. And of course, as mentioned earlier, we had some smoke impacts. And I'm thinking, just looking at some other data, the dates that we probably saw the most impacts were between the 7th and 8th of September, and also the 16th through 19th. And from my recollection, most of that smoke was coming in from California. They had a number of very large, what we call mega fires, that blew the smoke up into a higher altitude and then deposited in Colorado along with some other states. Okay, so I'm just going to go into the data graphed out very simply. We looked at there's two NAAQS for particulate matter. One is PM 2.5, which means it's very fine particulate matter. And this is, because it's finer, it's more of a health concern. The finer the smaller the size of the particulate matter, the deeper it can get into lungs and cause respiratory issues. The NAAQS for PM 2.5 for the daily average is 35. And as you can see, we're pretty well below the NAAQS, except for this one little spike. I looked at Pitkin County's PM 2.5 data, and it showed a similar spike. And to tell you the truth, I don't know what was going on that particular day. It could be dust, but both the sensor at the fire station and the reference monitor in the city both picked up elevated concentrations of particulate matter. Let's see, and here's the PM 2.5 for September, the 6 days worth. Kind of interesting. Again, we're still below the daily average of 35, and these higher numbers are most likely due to smoke kind of drifting into the area. Getting into PM10, which PM 2.5 is kind of a subset of PM10. So this is 10 micrograms or less, typically heavier. And also, I just want to mention the source of particulate matter is usually smoke or windblown dust, or dust kicked up by vehicle traffic, whether it's an airplane or a vehicle. And also diesel. Diesel can put out some particulate matter as well. So here's the data for June for PM10. You see the same spike. The daily average is 150 micrograms per cubic meter. We are definitely well below that standard. And same thing goes with the PM10 for September. Nitrogen dioxide is also, there's a NAAQS for that. 100 parts per billion. Sources of nitrogen dioxide are usually mobile sources, just burning engines, industry. It also can play a role in the formation of ozone. We see one spike, and to tell you the truth, I really don't know why there's a spike. Everything else seems to be kind of just grinding along, up and down, which is normally what you would see. But again, we're still below the National Ambient Air Quality Standard, the hourly average standard for nitrogen dioxide. And then again, we've got September, actually lower values than we saw in June for nitrogen dioxide. I'll go in a little bit with ozone, and then if you have any other questions, I'll try and answer them. but here's a little graphic. Ozone's not emitted directly by any engine. What it does is it forms photochemically with sunlight, nitrogen oxides, and volatile organic compounds. And it's, you know, it moves around with the wind. It can move around diurnally. Sometimes we see higher, we'll see higher ozone concentrations at higher elevations. Nighttime and daytime play a role in the concentrations. The APHIS sensor did have an ozone, it did sample for ozone, but what I found when I ground through the data, I found that it was let me see, I'm going to try and go back. Well, anyway, whatever. Sorry, I'm trying to get back on the Zoom. I'll figure it out. But anyway, I found that it was, the data just didn't look, I couldn't rely on it so much. So I did a little research into the sensor, and it does tend to overestimate by 60%. Pitkin County has an ozone monitor 3 miles from the airport. And in my opinion, I think that that monitor is a pretty good reflection of ozone concentrations in the general area. So with that, I am open to questions as soon as I figure out how to get out of here.
Any clarifying questions for Andrea? Okay, seeing none, we can keep moving on and we'll, oh, sorry, Steve, go ahead.
I'm really curious about the spikes in the NO2 and what the other, I can't remember what the other spike was in June. That seems really odd, but I wonder if there's anything that was going on at the fire station that they might have been doing something right in that immediate vicinity that might have caused a spike like that.
It's possible they might have just been running up their engines or doing some kind of exercise, and I don't know. But I was kind of curious about it as well. I don't know, Howard or Greg, do you have any ideas, thoughts?
Not about necessarily the big spike, but I think anytime that you have a pollutant that is potentially dominated by the traffic, such as you might expect with NO2 to see some spikes on a diurnal basis, that would be associated with peak traffic volumes would not be unexpected.
Also, the PM 2.5 in June, I don't think the wildfire season had really started going then, but I mean, I was looking at the purple rain every day here and seeing what the, you know, what the figures were for the, I can't remember now, but it was PM 10 or I think it will measure different things, but that wasn't happening in the middle of June, was it yet, when the peak of the wildfire season came later?
No, we, the Grizzly Creek fire, which is I think the first wildfire that brought smoke into the valley, that did not start until I think July. But sometimes you get, you know, that was a dry summer, and we do get these wind events, and it could have just picked up a lot of dust and blown it up valley. And the fact that I saw the same peak in the monitor in the city, it kind of indicates that there was something more area-wide going on than something directly related to State Highway 82 or the airport.
Yeah, going back to the NO2 spikes, I think you'll find that diesel engines and aircraft engines are notorious for having high NO2 emissions. So it's quite possible that if you had a fire engine idling outside the shop, I mean, you could potentially see NO2 spike. That would, especially on top of a fire station. I don't know what sort of NO2 control devices are on the engines there, but that wouldn't be surprising. Another option would be that, you know, these are small sensors, and, you know, they could be glitchy at times, and they are affected by other parameters like humidity or other, just other things can affect these types of sensors. So it could just be also an anomalous blip too from the sensor.
Looks like Rich has a theory.
I do have one theory. That building and I believe the airport have generators that have to be exercised once a month. And that may have been, we could get with the fire station and find out from facilities if that happened to be a time they may have exercised their generator. So just a theory.
Well, and I'll offer my theory and then move us along. I believe the Castle Creek Bridge was having work done maybe about that time where they shut down the bridge in one direction and both directions at times. So we could look back at our calendars and see if that lines up, because that might explain why it would be more area wide. Okay, Cindy, let's move along in our presentation because we have about 20 minutes left, and I do want to make sure we have enough time for discussion.
Right. Thank you. I'd like Greg to explain his benzene chart. And Bonnie, I don't know if you're able to bring that up. I think it was Exhibit C. Thank you. And Greg will explain why we looked at benzene concentrations and what that means. Thank you.
Yeah, so here at the state, we've been having a lot more interest in doing risk assessments with regards to air pollution. One of the things that we've been finding, and we've been working closely with the state toxicologist on trying to develop methods to do risk assessments. And over the time, and most of our work has been done with regards to oil and gas developments, drilling operations, midstream facilities. But one of the things that we found that is the most significant driver in toxicological risk is benzene. So when we started developing the study, we had a very specific interest in trying to do as much benzene assessment as we can. So based upon Howard's canister data, we were able to collect benzene from those measurements. What we use as a way to evaluate the risk associated with the benzene measurement is using health guideline values. And Howard briefly touched on this with his EPA reference concentrations. So when we say health guideline values, they are fairly synonymous with what Howard was saying with regards to EPA reference concentrations. However, I'd like to dive a little bit deeper into that, and that we go in and take a look at kind of an acute level, acute response, and a chronic response. So the difference between acute response is a response that is evaluated over a short period of time, and a chronic response is what's evaluated over a longer period of time. As what Howard said, a response over a lifetime of exposure to this compound. So on the lower table there on the graph, you see I have an acute health guideline value and a chronic health guideline value. Now, one thing I think that we should kind of lay out here is that with regards to ambient concentrations of benzenes, these really are not standards. So, and I think a lot of people would like to have a standard in place, but just giving our current regulatory with air toxics values, an ambient standard really isn't in place for any of these BOCC compounds. These compounds are regulated more from a source perspective. So the standards for benzene are regulated with emissions from stationary sources. So, and then there are some ambient standards, but they are in the workplace environment under OSHA. So when it comes to just public exposure in an outdoor environment to BOCC compounds, there's really no standards in place. So we were able to, and Howard showed this on that lower table, we had the chronic health guideline values. And I did an assessment of these and I calculated the
Ooh, we just lost your sound, Greg. Is that our problem, Terry? Hang on. Can I just interrupt here? Can everybody else hear Greg or no? Okay. Time out.
I don't think he can hear us.
Okay.
either.
Let's just hold for a sec. I'm going to shoot Greg a chat and hope he sees it. If one of you have his phone number and can text him, that might be helpful too.
We can't hear you.
Cindy, can you hear me?
I can hear you.
Okay. Well, I shot Greg a text. I don't know if he's gotten it. Or a chat.
He's not responding.
No. Terry, is there any way you can like kick him off and we'll get him to come back?
That's what I'm gonna do now.
Okay.
Hopefully he'll join us back here in a second.
Okay. So we've manually removed Greg from the meeting and hopefully he'll get a pop-up to rejoin us, or be told that he's been removed and needs to rejoin. So I think maybe what we'll do, just in the interest of time and not knowing how that happens, Cindy, is there anyone else to present, or should we open up for discussion and more questions?
No.
Just on a technical note, I did text him. I have his cell, so
Oh, good.
hopefully he'll see that.
Okay, great. Thank you.
Sorry to
Yeah, too bad. The bottom line with Greg's presentation, I think, is that he did a really in-depth look at benzene and whether or not those concentrations based on the EPA standards were of any health hazards, and the finding was no. So with that, I think we can go ahead and open it up for any questions that the board might have, but I'd also like to circle back to the end of the presentation, which is that in talking with all of the experts here, we realized that, there are a lot of different things that are being looked at relative to the airport's impacts on air quality. And it's not only these criteria pollutants that we've looked at or the hazard pollutants that we've looked at, but also the greenhouse gas emissions, which I believe are also very important, and to the study of the airport and what we looked at with the recommendations and the final recommendation from the Board of County Commissioners on what to study in the long run. So with that, Rich and I have talked a little bit about where things are going next, and potentially an airport advisory group could look at prioritization of how we put together a program that would take into account all the different parameters we need to look at. But what we've learned is that there's a difference between the modeling, which we looked at during our airport study, and the modeling which was more about the aircraft and what kinds of pollutants we were getting from the aircraft, versus something that's called calculating, that Howard's done a lot of, where we basically look at the point sources of emissions from the airport, say the APU units, or the traffic on the airport, or anything else that might create greenhouse gas emissions or other pollutants. And then the third thing is the actual monitoring, the actual putting out a monitor for specific types of pollutants. And we've learned more through looking at a couple studies where there have been studies basically at the end of runways looking at the pollutants put out by jet aircraft. And so we would want to study those more specifically. And with that, I'll back out, see if Rich has anything to add about maybe a future study, and then just kind of give it to the board to ask questions or give us advice.
Thank you. Go ahead, Rich.
Yeah, thank you, Kelly. Not really much more to add, other than the fact that I think this, I appreciate all the work that's been done here by these experts. A lot of time spent, so thank you very much, first off. But the board has accepted the common ground recommendations where there's some targets in there, and I think we're going to have to establish something a little bit more on site to really get a good idea of kind of what's happening here. We do know that the wind does blow north-south, it seems, so that's whenever you talk Woody Creek and you talk Buttermilk, that's more of kind of the north-south direction. So I think it's going to take a little more study for sure, but we've talked about with this group, and as Cindy mentioned, Howard has got some familiarity with calculating, and that would be if we took 5 trucks and turned them to electric, what kind of emissions reductions do we get? If we do the jetways and we get rid of the CPUs that are out there and go electric with those. So I think there's some quantitative things that we can do outside of just monitoring itself. So, but with that, I think the study's good. I think the good news is that we weren't seeing levels that were of a health concern. So that's the good news in this, but I still think there's a lot more to do.
Thanks, Rich. Greg and then Steve.
Great, thank you. First of all, I want to thank everyone, Jeanette, Andrea, Howard, Greg, everybody who contributed to this. I really appreciate this, and Cindy, of course, as well. I'm not taking you for granted. Really appreciate what's gone into this. I've just been thinking, as we move forward, I'm not sure how localized, but we're really gathering some valuable information here. And it could affect how we design the engine run-up area on our airport. Which direction the jets are facing as they run up their engines before they take off, for instance, might actually make a difference with the air quality, especially looking at the lumberyard area of the ABC, which could become very dense human population if the city goes forward with their plans on the housing. So this could really have a positive and valuable impact on our future plans and design for everything that's happening around the ABC and the airport. So I'm certainly encouraged, and I want to see more. As we go forward, it's really fascinating. The last bit on this is I'm just looking at articles on fuel dumps and on areas where neighborhoods have noticed high degrees of jet fuel affecting either crops or just people's respiration. And it has been involved with fuel dumping from aircraft. And I don't think that happens very often. There's no financial incentive to do it. And usually it only happens when an aircraft is in distress. But it'd be interesting to learn just how efficient a fuel burning aircraft is when it's operating at 8,000 feet elevation to begin with. Just wondering if we may have more of a problem with unconsumed fuels than we knew. Just a thought. Thank you for that, and looking forward to the next conversation.
Thanks, Greg. Steve?
I know that there are calls from the community, people who live, I'm not going to name any names, but people who live in Aspen Village and in the Woody Creek area. Other people from up towards Cemetery Lane and Buttermilk area periodically have complained about the jet fuel odor there. I am wondering if there's any way that we can do on a day when there are really bad complaints about the odor at, say, Buttermilk. Is there a way to do a snapshot sampling to drive to that location and take a sampling of the air there? This has to do more with quality of life, because if people are smelling the odor of jet fuel, maybe by the health standards, maybe it's not going over the certain level that it's bad for your health, but it is bad for people's mentality when their quality of life is deteriorated by the smell of the jet fuel. And I don't know if there is a way to take a snapshot sampling at a location. So for instance, if it's a particularly bad day, we could have Kurt run up to Buttermilk, run to Cemetery Lane, run down to Aspen Village and take a sample right then, all on the same day from those various locations that the members of the public want us to do monitoring there. We can't do a long-term monitoring, I don't think, because it's so expensive to do multiple stations. So I'll just pose that question. Is it possible to do what I described?
Let me make sure that the board can weigh in, and then we'll collect our questions and see how much time we have for answering. So Patty, I think you wanted to ask a question.
Yeah, can you hear me?
Yes.
I'm on a different computer now. I think we need to look at doing some monitoring that was recommended by the 2 letters we got at 2 other points, say the Buttermilk, just so people have that data. And then somewhere maybe the Woody Creek Fire Station, so we could get that neighborhood too. I don't think that's gonna hurt. As far as Steve's suggestion, I'm gonna weigh in real quick. We can't have Kurt Dahl on call for a moment here and a moment there. So I don't know how, that's kind of difficult, but unless you guys have some great ideas as to who can be running around town and be at our beck and call when somebody smells something, I don't know if we can do that. The other question I have real quick is the ethanol issue. Is there a greater percentage of ethanol that might be released from cars versus jet fuel? So that's just a question somewhere down the line. But thank you. I thought this was a great start. I think we have a long way to go and more information to gather. But we promised the public we would get started, and I think we followed up on that promise. And now we just need to look at how we might want to expand it moving into the future. Thank you. Thank you all.
Thanks, Patty. Francie, you want to weigh in at this time? You don't have to. I just want to check in with you. Okay. And I'll just weigh in, and then we'll turn it back for, I guess, some feedback from the experts and Cindy. I guess what I see here are sort of 3 problems that could be tackled. The point source pollution, the non-point source pollution, and then nuisance or odor complaints. And I think that there's a lot of energy we heard from our airport committees related to source pollution at the airport, and so that to me seems like the most straightforward thing to commit to at this point. But I don't know if there's an opportunity to design a program that would also capture some of the nuisance odor complaints or the broader area non-point source in a reliable and I think informative manner for us to make decisions on. So that's my feedback right now. So I'll turn it over. It looks like Howard, I think, had a question to answer for Greg and Steve's.
Try to answer a couple of the questions. First, related to ethanol. Ethanol, I believe, is up to 10% of the gasoline. We were seeing ethanol in our monitoring at the fire station. One potential source of that was the fact that we're next to the Conoco station, and so ethanol vapors that are part of the gasoline vapors that would be present during refueling of motor vehicles, that could be where we're seeing the ethanol. That seems to me to be the most likely source of that. And so ethanol is a ubiquitous part of gasoline motor fuel at this point, and so it's probably not unexpected that we would see that. I think, as Rich had indicated, we had talked to him about kind of a long-term tracking program that could be implemented at the airport to track the level of emissions, and in particular, then we would have a quantitative measure if you're trying to reduce emissions by 30% in 10 years or whatever the number is. How do you measure that? Well, it actually, we could do that. We could set up a system where we would calculate the emissions on a continuous, rolling basis every year, to determine how the operations and how changes in operations have affected emissions, and you can have a measurable program that you can look at targeting. In terms of trying to chase around and the problem, I mean, the technology that we employ, the TO15 samplers, could be deployed at any location. The dilemma from a standpoint of not using them on a regular or continuous basis is that once I get them from the lab, they have a shelf life. And that if I don't use the canister within 30 days, then the canister really is, I don't have a valid canister to collect samples in anymore. And so the dilemma would be to have that ready to go on a moment's notice. It could be deployed if you have it, but it's not really effective. It's not really designed to be something that you could take out and leave, you know, at a warehouse and then go fetch it 90 days later, because then the canister will have expired. And it takes me about a week to get the canister from the lab once I order it. So we could look at whether or not there are other technologies that could do that, but at least the technology that I'm employing is probably not conducive to kind of a ad hoc kind of program. I think you'd be much better off going and maybe just setting up I mean, one thing, and I did this at a industrial client that was located next to an odor producing source, is that we set up a logging system to track when the odor complaints occurred. And then we could try to analyze that data to assess, is there a particular type of weather condition, operational condition, something else that then we can then use to sort of say, okay, let's do sampling during this kind of period. You know, we talked about inversions before. If there are a much more predominant, the odor complaints are much more dominant during an inversion episode, then you do sampling during an inversion episode, and maybe you'll get some and maybe you won't get any odor. But if we can determine, we can link the odors to a certain operational condition at the airport or in the city, or a certain meteorological condition, then you could design a sampling program targeted at that kind of condition. That would be, I think, how you would best handle it, other than to maybe just do something where you would pick a site and you would rotate samples through there on maybe a quarterly basis or something like that. It would be a more regular program, but if you knew the types of conditions that led to the odor complaints, you could then try to design a monitoring program that would only be executed during those events.
Howard, are you familiar with the Garfield County's grab sample program during the height of oil and gas?
Yeah, I'm not familiar with it, but I'm sure I can find out through others at ARS about it, and so, you know, I can talk to my people about, you know, whether or not there is a kind of technology. I was just saying the technology that we employed for your study, I don't think is conducive to the type of monitoring on demand, for lack of a better term, Steve. But there may be other kinds of techniques. I think the other thing that could, the continuous analyzer like the APIS sensor, those are low-cost sensors. And so those could be deployed en masse and run for a continuous basis, just to kind of see whether or not, and whether or not then that would again give us more indications of the types of conditions that would then lead to a more detailed or sophisticated sampling approach. But you could do an APIS type sensor and deploy multiple sensors at different locations. They would run more or less continuously. So then they would then you could see whether or not, then what do those sensors show when an odor complaint occurs?
Okay, we do need to keep moving along, so let's take a few more minutes. Greg, go ahead.
Just want to say that I really appreciate Howard's comments on that, and that's kind of where I was going, is that maybe an APIS sensors would make some sense. But with a citizen science program, this sounds like something that if we set it up properly, we could invite the public to get involved and log in, and maybe we do place some APIS sensors. If we go that far, I think that would be valuable. It'd be an interesting experiment. If how valuable it'll be, we don't know, but it seems to me that it's not out of the range of affordability to try it. So, and we know groups in the community who are doing citizen science with the river, temperature taking, things like that. So I think our community would probably rise to the challenge and participate in that if we see merit in it. Thank you, Howard.
Sure. And I do think, since odors seem to be driving it, I would look at some sort of more formal program to log the occurrence of odors, when they occur, what location, any kind of qualitative description of what they're sensing. Is it strong, mild? You know, I think, you know, we could think about setting up it could even be something where people would then log in and just log it on the internet.
Mm-hmm. Thank you. Francie.
Okay, I got it. It seems like it would not be very difficult for high school students to set up correlation graphs between meteorological information and the sensors that you're talking about. So, or even retroactively for those days that you were talking about in your report, where we could see if there were inversions or what the atmospheric pressure was and some things like that, so that we would understand what is causing an increase in pollutants and possibly the odors. Obviously, it might have to be a 3-tiered correlation graph with the pollutants monitored, the subjective odors experienced by citizens, and then the meteorological information. So that's one thing I wanted to say, but I also wanted to ask whether the decrease in exhaust from the more modern airplanes that we've talked about in terms of our airplane design, whether those are the same exhaust chemicals as the ones that are being emitted from aircraft now, or whether the components of the exhaust change as the design of the airplane changes. Thank you.
Okay. Is there an expert who wants to answer that quick question from Francie, or?
I don't know that I have expertise specific to airplanes. I think my expectation would be that the fuel has a lot to do with the emissions, particularly odorous emissions. I think comments about whether or not the engines are effective at high altitude. I mean, remember that engines are always running at altitude, because it's an airplane. And so my expectation, without necessarily having any documentation otherwise, would be that an aircraft engine is less affected by altitude than perhaps a standard car or truck engine, because an aircraft engine has to be designed to run at different altitudes just by its nature. But it could be something that we could do more investigation into. But we know that motor vehicles, will burn differently. But whether or not that altitude effect also extends over to aircraft, I'm not certain about. But I think that I think one of the things that, if I were to redesign the study, one of the things I might think about doing would be deploying my set of sensors at the end of the runway to try to see if then I can pick up a signal. Because if there is an impact from the airport anywhere, it's at the end of the runway. Particularly given the fact that Aspen is very unique in the fact that all the aircraft arrivals and departures go in the same direction. That's the only airport I can think of where that happens. So if I deployed my sensors at the end of the runway, I might be able to determine what pollutants then am I looking for elsewhere in the community to see if I can find that. Is there something unique? Is there a pollutant that is unique to that point that I don't find, that I wouldn't expect to find anywhere else? And then if I deployed my sensors at Buttermilk, we could look for that signal and see if that was found, and then that would be something you could then correlate to the airport. But those are just kind of ideas I'm kicking around based on what we've learned and based on some other literature review that we've done as we were trying to assess the impact and what we were finding in our data.
Thanks, Howard. So I'm going to wrap us up here, and I'll just summarize what I think I heard as far as maybe direction for staff. So what I think I heard is interest in having an airport subcommittee look at how we would solidify baseline data and then start to actually measure, or what was the word you used, calculate reductions through specific actions as sort of one request of that group. We also heard interest in having additional broader-based monitoring at Buttermilk and somewhere to the north, Woody Creekish, Aspen Village possibly, for consideration. I would note that, Andrea's volunteer services could not be probably assumed. And so even though affordable in the canister and collection, we would have to pay for data analysis and budget that. And then the third thing, a more formalized program to track nuisance complaints so that we can maybe start to associate them with either events or activities, man-made or weather-related, over time. So those are the three kind of possible direction paths forward that I've heard. I just want to check in and see if I've missed anything. Okay. Well, thank you all very much for your time. Steve, go ahead.
Well, I'm looking forward to getting input from our Citizens Advisory Committee that we are going to be forming. I think that they will probably be all over this topic and wanting to help out and, providing input on it. So I look forward to what they come up with.
I'm sure it'll be more than we've offered today. So that's great. Okay. Well, thank you so much to everybody. I appreciate everyone who, joined us at this time, and take care, stay safe and healthy. And I'm sure we will hear from you again in the future. And thanks, Cindy. I know this was out of your wheelhouse, so we really appreciate you taking this on.
Thank you. It was really a lot of fun, and I appreciate everybody who helped out, and really hope that we can create a great program that the community will have confidence in. Thank you.
Great. Okay, so I'll move us along. We have a half hour to do future agendas, board open discussion, and then get into executive session for the rest of the board. So Patty left, so that'll get us through future agendas pretty quickly, I think, here. I need a minute to pull mine up. John, do you have any comments on future agendas currently?
Just a few things for board members to be aware of. February 9th and 12th, I think it's 9th through 12th, there's Colorado Water Congress Conference. We'll have 3 board members attending that, Kelly, Greg, and Francie, who are being registered. It does sound, though, like it's a virtual conference, and you all will be able to work around the BOCC meeting on February 9th. So if that changes, be sure to let us know. And then just wanted to give you a heads up that we are beginning to schedule Healthy Rivers and Streams renewal interviews, and they're being scheduled over the next couple of weeks. We have 3 members that are seeking renewal. That's all I've got.
Okay. Looking to the rest of the board, any corrections or questions about future agendas? And Francie, this is an opportunity, if you have a topic that you think the board should have a presentation or discussion around, feel free to put it out there, and this is when we decide whether and when to add it to the agendas.
Yeah, well, that's why I had my hand up. I've been the recipient of quite a few texts or emails, rather, from Valley residents over here regarding the last caucus meeting, Kelly, that you were at. Mm-hmm. And there is some angst about the way people were excluded from voting, and if they didn't live on the boulevard, how could they vote? And yet it was a caucus meeting for the entire valley. And then there was concern from people who thought that they had actually passed something that was going to be enforced, that there weren't going to be any short-term rentals in Redstone whatsoever. And so it was pretty confusing to quite a few of the people who attended the meeting and people who have heard about it since then. So, and they did, in fact, pass, as you know, I don't know what it would be called, a resolution to not have short-term rentals, yet it wasn't structured, it wasn't written in a way that they were passing something to come to the Board of County Commissioners. And I did talk to John about, well, do they have any capacity to restrict STRs? And he said, no, only the county can zone it to outlaw STR. So it seems to me they need to come before the Board of County Commissioners if they want to do this. So there's that. So I don't know whether we need to talk about it as the BOCC first and just decide how we should get back to them. I do have a phone call on Thursday with one of the people there to hear their concerns and stuff. So anyway, it's kind of a ballooning issue right now, and I do think that we should consider addressing it in some way.
And if I could jump in, we actually have a work session set up with the board next week on the 26th on short-term rentals to talk about both there's recently legislation passed allowing the county to license and regulate short-term rentals, as well as the zoning piece, which you referenced, Francie. And so we have set up time for a work session so that the board understands those 2 opportunities and to get some direction, because different parts of the county, I think, are probably going to feel differently about short-term rentals. But the caucuses themselves are advisory bodies to the board, as you probably discussed with John. But we do have that set up next week, so we can get some direction from the board how to approach this, because we're hearing from a few parts of the county about this.
Okay, great. Thanks, Tom.
Yeah.
Okay, Patty, you're back. Do you have any future agenda items?
Yeah, I do. On the 27th, we have an issue coming before us as to the uses for the Emma store. Are we going to have any discussions about that before it comes to us in a specific resolution?
I don't have an answer.
Yeah, we've been going. Yeah.
I mean, without having a discussion and having a resolution come before us, I mean, we haven't seen any, we saw the preliminary, but we didn't see any of the further addressing our issues and concerns. So I don't know if we just want to throw it at us it's a 1 reading reso.
Mm-hmm.
Just looking to see, we could probably fit in a discussion even the Tuesday before, and then if the board has, so I'm looking at the 26th, that's on the 27th, right?
Yeah, the 26th, we start at 11, so we can maybe start earlier, because then the rest of the day is pretty packed, and I know that, John, you're scheduled for your 1 hour at 3:30, which means 6 hours, so that'll take up the rest of the evening.
The key might be to putting John at the start of things, not the end, so we have to cut him off.
I know. So anyway, I just thought maybe if the board's comfortable with a one-read reso coming at us without any discussion, I don't know. I'm not
No, I think that's a good idea.
comfortable or uncomfortable.
I think it's a good idea, Patty, to understand what, if it's not contentious, then it's a short discussion, but if it,
Yeah.
Yeah.
I think it's worthy of more than just an open discussion item, maybe a half an hour that morning, John.
Mm-hmm.
Kelly, you and I can discuss that at our future agendas, but just, I think the rest of the board's comfortable with that.
Yeah, so we're looking at 10:30 on the 26th.
Yeah.
Okay.
Thank you.
Okay, if there's no more future agenda items, then board open discussion. John, do you have anything for us, please? No?
I don't have anything for you right now.
Okay. Other board members, yep, Patty?
I have something real quick. I've been receiving lots of information about violations of our new red zone issue as far as social distancing and masks. I did contact John Knieper at Buttermilk about ski instructor. You're going to love this one. Wearing what do they call those things you pull up over your face with his mouth? Yeah, with his mouth cut out so he could talk to his clients. But so they're on it. I just wanted to just give the board the head up. The other one was an Instagram posting for a restaurant here in Aspen, posting reservations can be made for private parties within the restaurant. So I forwarded those with information as much as I could garner. I copied the Instagram photo and sent it to Consumer Protection. John, just like the one I just did about somebody inquiring about churches, I just copied that email and sent it on. So just to keep the board with a heads up that people are really trying to stay compliant and they're really not happy. And a lot of it is local restaurants who were being really good, who are now shut and seeing other restaurants still not behaving. And I think it's important that if we get contacted, we forward those information to Consumer Protection with as much information as we can provide them.
Yes, Francie.
I just wanted to add to that a little tiny bit, and that is that some people in my family went skiing at Snowmass. I believe it was on Sunday, and said that they went too far down, so they ended up down at the village, the new village, and they said it was shoulder to shoulder, and some of the people had masks on and some didn't. And she said that even sitting outside at the restaurant, the tables were so close together, and of course people weren't wearing masks because they were eating. And so she was concerned and didn't really feel like she wanted to take her family skiing again. So maybe we could specifically get some of this information to the SkiCo so that whoever is doing the reminding to people that they would do it a little more forcefully. I don't know whether we want to get this specific kind of information, or maybe we could have SkiCo do a survey or something where they're actually asking skiers, what are you experiencing, and something like that to make it a little more effective.
Well, one of the issues, Francie, was the mall in Snowmass with people lined up in front of to-go food, people sitting at the little picnic tables were out there. We had a lot of young people in town this last week. Most of them that I saw in Aspen walking the streets had masks on, but there were some issues at some of the local restaurants with outside eating areas that still exist. The people just packed in. So, but Consumer Protection needs as much specifics as possible for them to really respond. I did, as I said, contact the head of ski school at Buttermilk with the complaint about the ski instructors, just taking their masks off when they're with their clients, but making everybody else around them uncomfortable. So, John, it's my understanding that consumer protection does need specifics if they're to adequately address things, but you can help me out with that.
Well, I think a little bit of both. I think generally compliance and snow masks had been good. Maybe we need to up our walk-arounds up there during weekend ski time, just to look at what's happening outside, particularly since the level red restriction went into place and there's no indoor seating. So we can make those general comments, but Patty, you are correct in terms of following up on a specific concern. That the more detail we can get, the better.
Thanks, John.
Yes, Francie.
Well, I also think that it wouldn't be so bad if we had more of a rolling agenda around closures. So, for instance, I don't know, I'm just thinking of somewhere at Highlands where it's way more crowded to ask people to sit outside to eat than to sit inside or to break it up in some way. And so if we're creating a situation where people are packed together outside because they're not allowed inside, that seems to be defeating our purpose in doing this. So I just want to put it out there that maybe we can continue to assess as time goes on rather than having an ironclad rule that maybe isn't being so successful in every venue.
All right, so that is a suggestion forwarded for Greg's consideration with the Board of Health. Okay, any other open discussion items? Yes, Steve.
One question that I am always puzzled by has to do with the availability of vaccines that are theoretically, there's millions of doses of vaccines stored someplace in freezer space somewhere in the United States. Can we get more information from the state of Colorado in terms of what do they have in storage? What do they know about what is in the federal government storage, and why is it not getting out to the public, the stuff that theoretically is there? I think that with the new administration, they'll probably be a lot more transparent about the situation, and maybe we will learn more in coming weeks than we have up till now. But I guess that would be a request to try to find out more about that.
Yeah, we certainly have been making those requests so that we can plan as far in advance as possible. Right now, what we understand is that the state has about 40,000 doses. It was holding for administration of second doses, and that they're looking at releasing those potentially this week for first dose. We will ask again on the federal side, Steve. I don't know that we've got a lot of good information on that. Obviously, the state was expecting to get 210,000 additional doses this week from, again, I think stockpiles that were thought to be for second doses, and apparently that didn't materialize. I know the governor had a pretty strong response to that, that got some national attention. But yeah, we'll keep looking for that information. We are as anxious to know, so that we can plan and get vaccinations into the arms of folks. So I don't know that we'll be successful beyond that.
Okay, wrapping up open discussion here. Give me a second to pull up the executive session agenda so we can move into exec, please. Okay, I am looking for a motion to go into executive session today for the purposes of discussion of the sale of Cougar Canyon, Yule Creek Mine Clean Water Act permit application, the Aurora Bureau of Reclamation and Pickens County MOU, an extension of airport service and occupancy contracts, the Lazy Glen Mobile Home Park wastewater treatment plant, jail litigation, Shady Lane easement request, and the Restaurant Alliance litigation, all pursuant to Colorado Revised Statutes 24-6-4024B.
So moved.
Thank you. Can I have a second, please?
Second.
All right, all in favor of going into exec session, please say aye.
Aye.
Okay. Thank you to the public for joining us today. Thank you to Terry for helping with Zoom and Grassroots for the broadcast. We will see you all next Tuesday at 10:30, it looks like, on the 26th. And take care, stay safe and healthy, and we'll see you soon. Thank you.